Thanks. And then if you guys could start putting your names and your campuses in the chat, that's how I take attendance. That'd be great. Okay. I'm going to go ahead and get started because I want to cover a lot today. I want to cover, let's see, am I recording? I'm recording. I would like to cover our week 3 content, which is part of the exam for next week. And all that reading came from the module this week. There were no readings in the book. It came from the 4 Canvas module sheets. So we'll go through that. Then I would like to do the quiz. So wait to do the quiz. Then I would like to do the attestation. Want to do that? And then I would like to, I'm going to try and do all this in the first hour because I would like to spend the bulk of the second hour doing the study guide for the exam. Okay, I just had a review a couple hours ago, had okay attendance, not great, but there were several people there. So just still doing attendance. And it was a good review. I'm going to send out the recording to it this afternoon after class. I'll send it to all the professors so that all the students have access to it. And I would highly encourage you to watch the reviews. You can certainly watch mine. I go through test taking strategies. I go through helpful hints for the exam. So I would definitely encourage you to watch the recording. Okay. Okay. Tawana McKay. Kenzie. Okay. All right, so that's our plan for today. Does that sound good? Okay. Does anybody have any questions from last week, or does anybody have any upcoming questions? I'm going to probably open the exam today or tonight, and it'll be ready for download. You guys don't have it till next Friday, but you'll be able to download it over the weekend if you would like. And obviously it has to be downloaded before you come to class next Friday, right? So you'll be taking exam 1 next Friday during this time. Please let me know if there's any issues. I haven't had a chance to start grading the case studies yet. I know there are a couple of people didn't understand that everybody had to submit, so I've reached out to those people, but overall just kind of spot checking them. They look really, really good. So yeah. No, wait. No. That's my RN class this morning. Sorry. You guys don't have case studies. Sorry. You guys have your group project in week 7. Sorry. But you all got your groups, and we broke out in groups last week. So you all should have a plan, right? Of how you're going to be working on those, right? Okay. I'm going to share my screen, and I'm going to go to our content for this week. Okay. Anybody have any questions? Okay, so I'm going to week 3 if you want to follow along. I'm going to week 3, and we're going to go through these 4 teaching sheets right here. migrant farm workers, rural populations, homelessness, and poverty. Okay. So let's start with migrant farm workers. What do we know about migrant farm workers? What do we know? What are some of the barriers that migrant farm workers might have with regards to healthcare?
They don't have
any.
What?
They don't have
They don't have what?
they don't have any healthcare coverage.
Right. They don't have any healthcare coverage, and they're usually not eligible for like supplemental programs like SNAP or WIC. They're just not. I mean, when we think about migrant is the seasonal agricultural worker, right? Often called a migrant farm worker, right? And their employment is usually seasonal based. Okay. Lots of issues. Housing is a big issue for them. Culture is a big issue for them. A lot of them don't speak the language of the country they're in working. And so it's hard to understand a lot about if there's an emergency, how do you access healthcare? How do you access appropriate housing? I mean, they're typically paid by the hour, and they typically obviously don't have vacation time. And so if somebody gets sick in their family, are they more or less likely to go to the doctors? Much less likely, right?
No, they're
Because they don't want to miss a day or just a day of pay, right? It's difficult to determine the number of migrant seasonal workers, but the estimates are 1 to 3 million in this country, right? And if they're traveling with their families or bring their families along, that number is much, much higher. Okay. The predominantly Hispanic, Latino, and they were born in Mexico. But there's also migrant workers that are white, African American, Haitian, and Asian. But the majority of them are Hispanic and Latino. Okay, interesting. The average age of the migrant farm worker is 38 years old. And the also estimate is just under half of all the, or 49%, just under half the, all the farm workers in the US are unauthorized workers, which creates what problem?
Overpopulation.
Well, it also creates an immigration problem, right? Because they want to, they don't want to be out in public accessing care or whatever for fear of immigration issues.
Yeah, getting caught.
Right? Yeah. So what are some of the common health concerns specific to a migrant worker? I don't know if anybody's read these 4 sheets, but this is how we're going to cover the content today. Okay. So we know that migrant farm working is a very physically demanding and intensive kind of work, right? Several health concerns put not only the farm workers, but their families at risk. Okay, and here's a list of 7. Heat-related illnesses, exposure to pesticides, injuries, urinary tract infections, other infections from
And I thought about it, if they don't have access to healthcare and all these illnesses and stuff is going on with them, what if they needed oxygen? They wouldn't be able to get oxygen. So that could be like, you know, really detrimental to, you know, the farm workers for a certain farm.
Absolutely. Absolutely. Which is
what,
yep.
It's a couple of my classmates saying that they can't get into Zoom, that they're in the waiting room.
Oh, yeah. Sorry. I have 6 people in the waiting room. Once I get going, sorry. Thank you. Thank you. Okay, here they all come. So, yes, Kendall, you're right. What happens if there is an urgent health issue? Yeah, that's the challenge of migrant farm workers. Okay, so they're also very susceptible to infections, maybe infectious diseases due to poor hygiene and poor housing, toilet facilities. They're at risk of bites from animals, infectious disease, back to that, TB, much higher risk for TB because of the crowded living conditions, right? Combined with the barriers of healthcare. And then with this population, there's also a significant increase in mental health issues, including depression, right? And why do we think that is? Just
living in fear, like just trying to hide out and survive, like barely living.
Yep. Yep. Constant relocation, whether you might have family members with you, your current living conditions. It's just a very, very, very set of circumstances that creates a lot of risk. Okay. We start to talk about a little bit of these, but the barriers, what are some barriers that prevent rural migrant farm workers from receiving healthcare and healthcare coverage, right? We know that they face a multitude of challenges to not only seek healthcare, but to find any kind of affordable coverage. I mean, what if they come to work seasonal and they have a child with a chronic health condition? How do they find affordable healthcare? Okay, some of their barriers are they can't afford it, right? In those rural areas, there's a shortage of services. You may have one family practitioner that covers 2 counties. You know, you don't have specializations. You don't have pediatric cardiologists. You don't have asthma and allergy doctors. You don't have high-risk OB doctors.
Or even interpreters, like who's around that can understand them. Like there may not be anyone.
Exactly. Lack of like you just said, lack of culturally and linguistically appropriate services, right? Are the few people that work in healthcare in these rural areas, are they culturally competent? Are they culturally sensitive? Do they know about the different groups coming in and working? Do they know about healthcare coverage that they can present to migrants, or if there's free care or reduced care? It's pretty tough being a rural nurse because you're everything. Okay, rural nurse, rural doctor, you need to be expected to know. I mean, talk about pulling all the tools out of your toolbox. We talked about that, you know, for this particular class. The reason why it's offered towards the end is because we pull everything together. We pull your med surg together, we pull your peds in, we pull your geri in, we pull your maternity in, we pull all this in. But think about, and also think about working in the rural community. You know, you may be the school nurse, you may be the L&D nurse, you may be the immunization nurse, you may be the home visit nurse. So anyway, the nurse should have some information if there are any healthcare options. And then can be confusing. I mean, let's assume they don't understand the language. How do you even communicate with them what options they have for food, for housing, for healthcare? Confusing eligibility requirements. We talked about that a little bit above. They are not eligible. They are typically not eligible for any kind of health insurance through their employer. And they're not really eligible for these federal funded programs like SNAP or WIC. They don't get sick leave. Their concern is losing paid time, social isolation and exclusion, right? And then for the undocumented workers, fear of how their immigration status will affect eligibility. Talked about that.
Their kids don't get schooling either, so they won't be able to like adapt to the population either, unless it's like, you know, somebody's kid out there at the farm.
And when we get to the next page, which is rural, children, it's identified that children are at significant risk in the rural community, significant risk. The frequent relocation is also an issue, right? It creates a challenge to the continuity of care, right? What if the migrant worker is diagnosed with asthma or hypertension or diabetes or some kind of chronic illness? Okay, and then they're moving around, okay, to another job in another state or another county. So the continuity of care becomes very challenging as well. Right? And so one of the things we know for sure is the constant relocation coupled with the general inaccessibility of healthcare, it really does prevent these workers from seeking preventative care. Okay, so when they're not seeking preventative care, they're showing up in our urgent cares and ERs with a more advanced stage of their illness, disease, issue, whatever. Okay, and they're very high risk for very preventable conditions. Okay, so that's the migrant farm worker. The next one is the rural client. There's a lot of similarities, but there are some differences. Okay, has anybody ever lived in a rural population, or does anybody live in a rural population now, or have family that live in a rural population? I currently live in a rural population. I go back and forth between, right now I'm way up in Northwest Wisconsin, way up north. And I primarily reside in Colorado near Denver, but currently way up in no man's land. Okay, it is as rural as they come. I'm surrounded by farms. I'm surrounded by very little people. And yeah, I mean, everything I teach about rural communities, I experience. It's pretty amazing. And so access to healthcare services, right? We know it's critical to good health for anybody, right? For everybody, access is critical. But rural communities also face barriers. Okay. Residents, let's see. So this is general. Ideally, residents of anywhere should be able to conveniently and confidently access services such as primary care, dental, behavioral health, emergency care, and public health. Right? We know that. Everybody should have access to that. What does that do? The overall access, it's overall physical, social, and mental health status, disease prevention, early detection, diagnosis, and treatment. Quality of life is better if we can all have convenient and confident access, maybe avoiding some preventable deaths, and life expectancy will go up. Right? So we know, like the migrant farmer, rural residents often encounter barriers to healthcare that limit their ability to obtain the care they need. Right? In order for them to have sufficient access, they've got to have the necessary and appropriate health services for them to obtain that in a timely manner. Okay? And sometimes that means traveling to the nearest city to get specialist care. Okay? One of the some of the other barriers for rural clients are financial means. You know, the rural population has a very high poverty rate. Okay, so financially, can they pay for the services? Right? If they can pay for medical, can they afford dental? Can they afford eye? Healthcare or eye insurance. Right? The other big issue in the rural population is transportation.
No. Why? I don't know, baby. Stop. Move.
Transportation is a big issue for them. What if they have to travel down to the cities to see a specialist? I'm just gonna try and mute everybody here. What if they have to travel a long distance? What if a lot of rural jobs don't come with insurance, health insurance or vacation? And so again, like the migrant clientele, they're not going to spend a whole day driving down to the city and losing a whole day's pay. Right? If there are language barriers, right? There'll be issues with their confidence in themselves, being able to communicate and understand with healthcare providers what's going on. And that's what we call, there's a term we call literacy. You know, a lot of rural clients are health illiterate. Okay, because of maybe lower education levels, communication barriers, and they just can't understand what's being told or taught to them. Okay. And then another big issue in rural healthcare is, we call this second to last bullet, trust that they can use services without compromising privacy. We call this anonymity. One of the big issues in rural healthcare is the lack of privacy. Why is that? Everybody knows everybody. Even though you're not supposed to talk, everybody knows everybody in the rural community. So because you have lots of issues with poverty and violence and substance abuse and mental health, the rural population is much less likely to seek out care for that in the early stages, because they don't want everybody knowing about all their problems, right? So by the time we eventually get to see them, it's usually in a much more urgent setting when it comes to child abuse or domestic violence or substance abuse or overdose, or right, because their privacy is extremely important to them, and important enough where they may delay seeking any kind of service or help. Okay. Okay, we talked about some of these barriers, distance and transportation. I want you to read through these sections. I'm just skipping through them. Okay, distance and transportation, we talked about that as a barrier. Workforce shortages, it is extremely difficult to recruit healthcare workers in the rural setting. Okay. Look at this chart right here. Okay.
I have a question.
Mhm.
In regards to our week 9 assignment, these last two topics that we talked about, the migrant farm workers and the rural population, how would we, could you give an example of how we would apply the ADPI guidelines? Because I
mean
see
in-
that that's what you asked for on the
In your
assignment.
project?
Maybe our week 7 assignment, the one where you said it was a good idea for us to take notes throughout class. This one, the HESI prep.
Oh, yeah. Okay. So I don't know. Let's think about the ADPI for migrants and rural. So let's say you're the rural nurse and you've been asked to show up at a farm, right? And do an assessment of what's going on at the farm. So how would you assess the population? I don't know, I'm asking, are they healthy? Are they sick? What are their risks? What are their barriers? You would interview them. What's going on? Do they have family members traveling with them? You would do the full assessment of what's going on. And then you would have to come up with a plan of how you're going to help them, whether it's resources or providing clean hand washing stations, whatever, right? So just walk yourself through the ADPI. Assess the population. What do they need? Come up with a plan. Implement your plan. And then you're going to have to evaluate if it was, let's say you were called to a farm because there was an increase in positive cases of TB. Right? How would you go through that assessment?
So it'd be a good idea to make up our own situation.
Yeah, sure. Absolutely.
Okay.
Yeah. And same with the rural
Alright.
population. Yeah.
Okay.
I guess what's more important is your understanding, that you have an understanding of how to transition the thinking of an ADPI with a hospital admission to an ADPI of going on to a rural farm.
Okay. Thank you.
Does that help?
Mhm.
Okay. Look at this all this purple. light purple, dark purple, this is all the the shortages in primary care. There's a lot, really hard to recruit. Okay. Health insurance coverage. Okay. This is, we don't really need to know this, but it gives you some statistics of the lack of health insurance coverage in the rural populations. Now, the Affordable Care Act certainly increased that. They found that 43% of uninsured rural residents reported not having a usual source of care. Okay, so they didn't have a regular doctor. Okay, they reported that 26.5% of the uninsured rural residents delayed receiving health care due to cost. Okay. And then another barrier for them is broadband access, internet access. Right? Although telehealth services is definitely becoming more popular because of the COVID, because of the pandemic, unfortunately, many rural areas lack access to the internet, right? Or have low speeds and can't access their meeting or visit with a physician online. Okay. Lots of organizations and charities are working towards making that better for the rural communities. And there's a graph at the end here. And then we talked about poor health literacy, right? Health literacy is another barrier to accessing healthcare, right? It impacts their ability to understand information, understand instructions. Okay. And we said the rural communities have lower educational levels and higher incidence of poverty. Okay. So your lower literate clients are more reluctant to seek healthcare due to the fear and frustration that they're not going to be able to understand what's going on. And so, and especially if you have low literacy, you're going to have a hard time navigating the health system. So, and then social stigma and privacy issues. Talked about that. Rural areas, there's little anonymity. Social stigma and privacy concerns are more likely to act as barriers, which is not good. Right? Rural residents can have concerns about seeking care for mental health, substance abuse, sexual health, pregnancy, over privacy concerns. Okay. So that's the whole, I don't want to do anything because I don't want to go anywhere or talk about, partner violence or domestic violence because I don't want it spreading around the community. Okay. And then lastly, we know that primary care access is critical to rural population, right? It's the most basic care afforded to them when they can get it, because a lot of what the rural population actually has the largest population of chronic health diseases. Why is that?
Because
It's too late by the time they get help.
Because what, Kendall?
Preventative care, there's no health clinics, health fairs, things like that to make them aware of what's going on with them. So it's too late by the time they come in.
And one of the things we'll talk about in the study guide is motivation. How do you motivate rural clients to access preventative care? Like you said, maybe access a health fair. Okay, what is it about motivation? And there's a whole section in the study guide that I need you to know. What motivates more? How can you motivate rural clients to be on top of their health care? Okay, and there are suggestions of ways to do it, and we'll talk about that when we get to the study guide. Okay. So what types of healthcare services are frequently difficult to access in rural areas? Home health. Why? The distance, the travel. Right? The no internet.
Delivery of their medications too, because like if you live within a certain distance from the pharmacy, they'll deliver them for you if you don't have a car, which they don't, but they live too far for that.
Right, right. Exactly. So home health services, hospice and palliative care, those are difficult services to access. Not so much that the nurse can't travel, but once she travels, there's no communication. Like she doesn't have the internet to communicate with doctors. Okay. Hospice and palliative care agencies often face barriers and challenges similar to other healthcare services in rural areas. Workforce shortages, recruitment, retention, reimbursement, limited access to the internet. Again, it is extremely difficult to recruit into the rural areas. And then mental health services, huge lacking of services in the rural communities. Okay. Often without the specialized mental health care providers, it's the primary care docs who have to fill in the gap. Right? Do they have a mental health background? You know, do they get adequate reimbursement? Okay, there's definitely research after research that indicates the need for more mental health services in general, but especially for the rural population. Look at this is the map of all the mental health shortages across the country in rural areas. Lot. Okay. Some of the other services, substance abuse services, lacking, OB. What if you have a high-risk pregnancy? Dental is a big issue. Okay, we know that oral health can affect overall physical and emotional health. Right? Oral health that's not treated can pain, cosmetic concerns, professional success, right? Dental care is very limited or very difficult to access in the rural areas. Okay. And then also the dental professionals in rural areas, there's far and few between. There's just not a lot. Okay, you can't recruit to be a dentist in a rural area. Okay. So there are some strategies to improve access. There's a lot going on to work with the rural communities. Okay, first thing is delivery models. Small rural hospitals are starting to partner with the larger systems in the next big town. Okay, so that delivery models, the access is improving. And there's a lot of links here to some good reading on how this is happening. Okay, so affiliation with larger systems and networks, efforts to improve the workforce. So recruitment, obviously an adequate workforce is necessary to maintain healthcare needs in the rural community. So lots of focus is going into recruitment and retention, trying to improve the broadband services so that increase telehealth for this population. Okay. And then there's some links here is what's being done to help rural veterans. What about the American Indians, the Alaskan Natives, and the Native Hawaiians? These are particular groups that are being focused on. And then this is a really good, I really enjoyed opening some of these and reading these. What organizations are working to improve rural health access? Look at them all. There's a lot. Lots of people, lots of organization, lots of groups working to improve the care and the access and reduce the barriers to rural health. Okay. And then private foundations as well. Okay. Any questions on migrants or rural? Let's talk about homelessness for a little bit. So you're walking down the street, or you're riding your bike or you're driving your car and you come upon panhandlers on the corners, homeless encampments, trash, filth. What do you guys think? I mean, one of the things that we need to check is our own values, our own beliefs, our own thoughts. Homelessness is the homeless is an extremely rapidly growing population. Okay, is there any community that any one of you live in that doesn't have a homeless population? I doubt it. I doubt it. And especially over the last couple of years with the pandemic, I was in school nursing up until last year. I retired, but the last 2 years in the pandemic, the number of homeless families, children went up significantly. Okay. It's a tough subject. It's a tough subject, right? It affects everybody. It affects all age groups. It affects women, men, kids, families. It doesn't spare any races, doesn't spare any ethnicities. Okay, the estimate is that on a given night, over 600,000 people are homeless in our country, right? And the other estimate that goes along with that is at least a third of those 600,000 are families. Okay. So we know that homeless people are more likely to become ill, right? They're more likely to have increased hospitalization rates, and they're much more likely to die at a younger age than the general population. The average lifespan for a homeless person is between 42 and 52. We know that homeless kids are much sicker and have much more academic and behavioral problems. I saw this firsthand in the schools, no question. Complex advanced medical problems, psychiatric illnesses exacerbated by drug and alcohol, combined with your economic issues, your social issues, whether your lack of housing, no transportation. The homeless population provides such a unique challenge to the healthcare system. Okay. I always marvel at because when I have to travel to downtown Denver to go to a doctor's appointment, I always have to travel right through the heart of where most of the homeless are located. And I always marvel at the workers, the team approach out there trying to help these people and these families and these moms and these kids. Okay, it's a multidisciplinary approach. Okay, the goal obviously is to try and make these clients as self-sufficient and try and help them succeed. So we define homeless people are individuals without permanent housing who may live on the streets. They may stay in a shelter, a mission, single room facility, abandoned building, or a car. Right? But we also consider homeless if they're in an unstable or non-permanent situation. So for example, during the pandemic, we had families moving in with relatives. Okay, because that was not a permanent situation or permanent, it wasn't a permanent solution, they were considered homeless. Right? So that's the last sentence here. They're considered homeless if they're forced to stay with a series of friends or extended family members, or if they've been released from prison or a hospital and don't have a stable housing situation. Okay. So we know over the past 30 years, the increase in poverty, growing shortage of affordable housing, are all the trends that are responsible for the increase in homelessness. And we have seen a dramatic increase in homelessness over the last 2-3 years. Okay. And people really don't want it. The grand majority of people don't want to be homeless. Okay. And everybody has a story. How did they become homeless? right? Do they experience a catastrophic financial event? Are there other economic social factors, such as loss of job, low wages, not being able to qualify for public assistance, people coming out of mental institutions, a veteran? We hear all the time of how many veterans are on our streets. Okay, low literacy levels, low education levels, no, can't afford health care. And then homeless people, compounded any of these factors we just talked about. And then if you compound it by alcohol, drug abuse, domestic violence, mental, physical illness, abuse and neglect, any of that can cause a person to be homeless. There's many, many risk factors. Okay. And we know that like migrant and like rural clients, homeless person, much more associated with chronic illnesses. Okay. And chronic illnesses along with substance abuse or mental illness, right? And if you have a combination of your chronic illness with, say, a substance abuse or mental illness, it's going to increase, it's going to lower your life expectancy. Okay, so a couple of statistics here. Homeless people are 3 to 6 times more likely to get sick. Their hospitalization rates are 4 times higher. And they're 3 to 4 times at risk higher to die at a younger age. A lot of homeless people have disabilities. Okay, and their disabilities prevent them, they're a barrier for employment. Right? It just kind of perpetuates that cycle of homelessness. And then homelessness and its impacts on children. Okay, infants born into homelessness have low birth weights, are 9 times more likely to die within the first 12 months. That's an incredible statistic. And then homeless kids are sick way more often than children who are not homeless. They definitely have an increased incidence of asthma, iron deficiency, lead poisoning, respiratory infections, ear infections, and on. They experience academic challenges, behavioral challenges in school, developmentally delayed, learning disabilities. I saw this day in and day out in the schools. These younger kids are more likely to experience hunger, abuse, neglect, separation from family, and have poor nutrition, right? So what's the most important thing we need to do? We need to think about our initial approach to families. What, as a nurse, going to be a nurse, what do you guys think is the most important thing that we have to develop with a homeless client before we can make any impact?
Trust.
Why?
Because they're not going to tell you anything.
Mm-hmm. Does everybody agree with that?
Yeah, I was gonna say empathy as well, just because you don't know exactly. You might know what they're going through, but you don't really know, and that's gonna create the foundation for trust and for them to feel safe to explain anything to you.
That's perfect, Celeste. That's perfect. Identifying the homeless patient and identifying the homeless patient and those persons and families at risk is a priority. Okay, so your first outreach will likely be your first contact with that homeless client. I don't know why we have the word patient in here. I like to use the word client with community. Okay, so during just a little bit of what we talked about, during your initial visit, we have to focus on genuine interest, empathy, compassion, non-threatening, non-judgmental, right? But the first goal is we have to address the symptomatic problems first. Okay. And those can be treated with simple guidance and will hopefully have a visible impact. So for example, if we know we have a kid that needs asthma or needs an inhaler, Okay, symptomatic problems first. What are the things that we can address right up front? Is there a lack of obesity? Is it obesity? Is it lack of food? Is it get those symptomatic problems first? Okay, once trust and rapport is established, then we can try and maybe get an emergency contact, maybe discuss the patient's more challenging social, medical, and mental health problems or end-of-life issues. Okay, and then again, we're going through the ADPI here. Okay, so this whole section is ADPI. So we're assessing the patient. What are their symptomatic problems that we can try and handle first? Once we establish rapport, then we can discuss what additional challenges they have. After completing the assessment, we can take into account logistical issues, logistical complexities, right? Come up with a treatment plan. We can make referrals, schedule follow-up appointments for kids, immunization appointments, diabetic clinic appointments, blood pressure check appointments, lab screenings, any therapies they might need, right? So it's a process. And part of the assessment, the first part of the assessment is establishing trust. Okay. The goal is trying to set short-term goals first, right? What is the urgent things we have to take care of? Here's some common with homelessness. You can read through this. I'm just going to identify the topics: cardiovascular disease, dual diagnoses, mental illnesses and substance abuse, cognitive disorders and traumatic brain injury. These are common health issues with the homeless. Injuries and violence. And then preventative health issues, infectious disease, STDs. Okay, we know that preventative health measures, periodic health exams, and immunizations are often lacking in the homeless population. Skin and foot problems, lice, scabies, bacterial infections are endemic in the homeless population because of poor living conditions. Exposure, cold exposure, heat exposure, frostbite. Okay. And so we know that the best model for care for the homeless involves an integrated multidisciplinary approach by a team. Okay. And it's a team that really needs to be knowledgeable about the unique challenges faced by homeless people. Okay. Okay. So that's our homeless population. The last topic I want to cover is poverty. Okay. Poverty and well-being. Okay. A lot of this beginning part is statistics that we really don't need to memorize. Okay. So the geography of poverty. Okay. Poverty tends to be clustered in certain regions, certain counties, neighborhoods, rather than being evenly spread across the country. Right? Research has shown that the poor living in areas where poverty is prevalent face impediments beyond those of their individual circumstances. Concentrated poverty contributes to poor housing and health conditions. I've already talked a little bit about that with the migrants and the rural population. Okay, if you live in a city, town that has a high poverty rate, that's going to contribute to higher crime, higher dropout rates, right? Poor health status of the community, maybe higher unemployment. And so with the poor economic conditions, it creates much more limited opportunity for residents to become self-sufficient. Okay. Non-metro counties without the high incidence of poverty are mainly concentrated in the South. Right, those with the most severe poverty are found in poor areas of the Southeast, including the Mississippi Delta and the Appalachia, as well as on Native American lands. So those are the three kind of targeted areas. Okay. An important dimension of poverty is its persistence over time. Okay. An area that has a high level of poverty this year, but not next year, is likely better off than the area that it's had a high poverty level for the last couple of years. With regards to poverty demographics, areas with a high incidence of poverty often reflect the low income of their racial and ethnic minorities. Right? So for example, non-metro, so not living in the city, Blacks and African Americans had the highest incidence of poverty, 30%. This is going back to 2019. While non-metro American Indians were at the second highest rate, right at almost at 30. Okay, and the poverty rate for non-metro white residents was less than half, 13%. Okay. So it's broken down, the numbers change based on racial and ethnic minorities. Okay, and we know that family type has a significant bearing on poverty, right? Families headed by 2 adults are likely to have more sources of income than a single adult family with children. Okay. That's a given. That's a fact. And then poverty rates also differ by age group. Okay, in 2019, this is where this research is coming from. The non-metro metro difference was the greatest for children under the age of 5. Okay, and again, you're responsible for reading what I'm skipping. I'm just trying to do an overview here. And then you can read about how poverty is defined. How do we define poverty?
A low income.
The federal government determines a poverty threshold, right? And if you fall below that, you're considered living in poverty, right? It was developed in the 60s, and it continues to be adjusted annually for inflation. Okay, and so the federal poverty threshold is the government's estimate of the point below which a family of any given size has cash income insufficient to meet the basic needs: food, housing, clothing. Okay. Okay. Do we have any questions about that? I would like for everybody to open up their computer and pull up the quiz. Let's pull up quiz 2. Let's go through and answer these together, and we'll get this done. And so everybody have it pulled up? We can answer them together and submit it. What's the correct answer for number 1? We just went through it.
1.
One, well, the first one.
Yep. And we all understand why,
Yes.
right? Because they're less likely, rural clients are less likely to seek care, seek preventative care. So when we finally get to see them, they're going to be much more likely to have complex issues, more advanced stage issues. Okay. Primary prevention question. Nurses developing a primary prevention program for members of the rural community. Which intervention is appropriate?
The last one. Would it be educate families on diabetes related foot care? No, organize a blood pressure.
And a local mom.
So, okay, let's go through this. What's primary?
Prevention. Preventing.
Okay. What's secondary?
Screening.
Screening.
Is screening.
Okay, so I'm seeing number 1 is going to be secondary, right? Because it's screening for pap smear screening.
Yes.
I'm seeing number 4 is going to be secondary because your blood pressure screening.
Yeah.
I'm seeing number 3 is probably is tertiary because why?
They already have diabetes.
They
Education.
already have
They already
diabetes.
have,
Because
right?
you're providing information.
Yeah.
So what are we left with?
B.
Sun exposure, because that's what they do.
Yeah, you're providing information on minimizing excessive sun exposure. So you're trying to prevent something before it even happens,
Right.
which is primary, right? Do you understand why 1 and 4 are secondary?
Yes.
Screening. Right? Let's go to number 3.
B.
Education. So,
Yes, the second one.
Okay, what does everybody
Number
else think?
2,
B.
ask the farm worker.
The
I
farm
say
worker.
B.
That is correct, because one of the, I don't know if we talked about this, but one of the biggest risks to migrant farm workers is pesticide exposure. It's one of the biggest risks. Okay, so if they're coming in with all these irritations, we need to know what they are potentially exposed to. Right? So number 2. Okay. During a home visit, the nurse notes that a migrant farm worker's family is living in a small house with several other families. Which nursing assessment is a priority?
D.
4.
Okay, does everybody agree that 4 is the correct answer?
Yes.
Yes.
Because what is a high risk factor for tuberculosis? Crowded
Crowded.
living,
Migrant worker.
crowded living conditions. Okay, question number 5.
Three.
Okay. Everybody agree that 3 is the right answer?
Yes.
Yes.
Why? Why?
Yes, 3.
That's that poverty. That's the poverty
They
concept.
gravitate.
Yes. Remember we said that financial stability or instability drives everything. It drives healthcare, it drives education, it drives access. It financial stability or instability drives everything. Okay. So number 3 is right. Number 6.
A.
I think it's B.
Which do the nurse anticipate for a family living just above the federally defined poverty line?
I say A.
Anybody want to go with B?
I think it's B.
I think it's B too.
I mean, there's not a whole lot of difference between living below the poverty line and living.
Let's say
Just
D.
above.
Right,
ahead.
because you did mention that even though
Right.
they may be living a little bit better, if they're still in that area, you know, they still kind of live like they do too.
Okay, yep. So what answer would you select?
I just don't feel like they have fewer community resources. I feel like it doesn't say rural, so I wouldn't think rural because it doesn't outline that. So having fewer community resources, I don't agree with that part, but it may be right.
They might not qualify for Medicaid or
Exactly.
Medicare.
That's exactly right. Yep.
That's true.
So
Yep.
even though they're just a little bit above the poverty line, they still wouldn't qualify for
Make
those.
enough to be able to
Yeah, they still
afford.
won't make enough. Right, exactly.
That's exactly. Yep. So what's our correct answer? What's the consensus?
A.
A.
Oh, we still have an A and a B?
A.
A.
Answer's A. Number 7. Which client is at the highest risk for adverse health outcomes related to poverty?
Probably the 68-year-old because when you get older, if you're not working and you have type 2, you get that monthly check that's not enough. I don't know. That's all I think.
I think it's
44.
D.
44.
I think it's D
Yeah.
Why is it D?
The farmer
because
worker.
he's a farm worker.
He doesn't want to miss a day of work.
Yeah, to take care of his health.
Well, that's true.
Yes, D.
Think of all the issues we just discussed of potential adverse health outcomes for a farm worker. Right? Okay, so D. Number 8.
Two.
B.
Yeah,
B.
increase out of school.
Yeah, I mean, that's pretty obvious, right? Because all the other answers, that's not what a impoverished adolescent would present with. They would present with an increased risk of unintended pregnancy. They would present with a terrible use of adaptive coping mechanisms. They would present with decreased attendance, right? So increased risk of dropping out of school. Okay. Which client is at the highest risk for homelessness?
B.
B.
Yep. Yep. And then lastly, number 10. Think of ABCs here. Think of your nursing process.
2.
Is it B?
Why?
Because they
I
already
would say
have
B.
drainage
B.
with
I'm
an
gonna say
ulcer.
1.
Well,
One
think of,
seems like they
what-
might got TB.
I say
okay.
B.
I say B.
I would say B
Question
for
is-
I say
infection.
B. I'm gonna put B.
Everybody needs to be seen. I get it. Everybody has an
Yes.
issue. But what issue is the most significant right now?
B.
B.
Wouldn't it be the
B,
drainage?
because
Wouldn't it be
they're showing signs of infection,
Yeah,
right?
infection.
Right.
Yeah. Okay. All right, everybody hit submit on that. And then while we're in here, let's just do our attestation now. After you submit your quiz. Let's just get our attestation done.
Wait, Miss.
Okay,
Yeah,
wait,
we
number
number
10.
10.
I
It said
got
number
a
10. It
10.
said we got it wrong. It said we
It
got
said
it wrong.
I
eight
got
out-
8 out of 10.
Yeah, 8 out of 10.
Which one?
And mine say 7 out of
It
10.
says that it should have been complaints of night sweats and unexplained weight loss.
And that's
And
the,
then number 7 says 44-year-old male working on a farm.
Yeah, that's
Yeah,
right.
no,
It's saying
number
that it's
7
wrong.
says
15
15-month-old
month old.
infant.
Yeah, it's saying it's
Right.
wrong.
It said it should
Yeah,
have been.
I got an 8. I got an 8 out of 10.
8 out of 10.
Okay, so
We
what
all
Got
two,
an 8 out of 10.
what two do we have wrong?
The
7 and
10,
7 and 10.
7 and
Number
10.
10.
Yep.
Then Brittany, you were right. It was A for 10.
I sure was right, wasn't I?
So,
Okay, Brittany.
so they're saying the correct answer for 10 is number 1?
Yep,
Yes.
the 15 month old. Yep.
Yeah, it says 7 is 15 month old.
Oh my God.
Wow.
And Brittany, you was right about number 10.
You sure was. You
I'm
got
gonna have to check.
Yeah.
I'm gonna have to
Are we
check
getting
those
our
out.
points back?
Are you giving her our points back?
Oh, you already
Duh.
submitted it.
Yeah,
Yeah,
we
you
submitted
told
it
us to.
Oh,
already.
yeah,
You
yeah,
told us
yeah.
to submit it.
Yes, yes, yes,
Told us to
yes.
submit it.
Yeah, yes. I'll take care of it. Yes. But
Okay,
I
thank
have to
you.
check on those. I have to check on those answers.
Please check.
The
I need to
15-month-old one sounds so weird because why?
I know that's
Yeah.
You're
I
what?
was thinking of 15-month-old too, because it's a baby. I mean,
Basis,
but whatever.
not history of.
Yeah, but there was a couple of questions on the quiz that the answers need to be changed for this term and I think these were 2 of them that may not have gotten changed. So
Okay.
if they didn't get changed, obviously I'll give you credit for them. That's why I wanted to do it together so we could talk through the answers, but no, that's a good
Okay.
discussion, good discussion. So don't worry about the quiz. Okay.
Okay.
All right, let's go in and do the attestation real quick. I mean, worry about the quiz, but I'll take care of those questions 7 and 10. That's what I need. Okay, so let's go do our attestation. Okay, there's 4 questions. 1 and 4 should be the same, so which is ridiculous. I don't know what. Anyway, it's set up wrong, but we have to answer 4 questions. So answer 1 and 4 is today. What's the date today? 21st. You attended lecture on the 21st with me. So put that in 1 and 4. And then tell me when you're ready for 2 and 3. Okay, you guys ready? So we just talked about this. What are some of the common health concerns specific to migrant workers and their families?
No F insurance.
No access to healthcare.
Access is an issue. Literacy is an issue, maybe communication barriers,
Lingual barrier.
language barrier. Yep. Not seeking preventative care, right?
Tuberculosis.
Yep, high risk for tuberculosis, yep. Okay,
Mental health,
mental health, substance abuse, on and on we can go. Just list a couple of them. And then question 3, how is homelessness defined? If you have to go back and look at our homeless teaching sheet in the module, you can do that. But how do we define homelessness? You don't have a permanent place of residence, right? How else do we define homelessness?
That pretty much sums it up, though. If you don't have a permanent place with a residence,
Right.
that means that you probably staying with somebody else.
Staying
or
with
you just
somebody
simply
else,
Somebody
or
don't have a home.
you don't have a home, you're staying in a shelter, you're staying in a group home, but it's not having a permanent place of residence. Okay, when you're done with that, hit submit. Now we got 2 things done. We got the quiz done, we got the attestation done. Okay, and now I'm going to jump to your HESI prep assignment. Okay, I would like for you to go, this is the assignment. I would like for you to go through sometime in the next week or so. Maybe your goal should be before next Friday, before you take the exam. I want you to go through this and complete what we've covered so far. Okay, so I don't know if anybody has this handy. We haven't covered bioterrorism yet. We haven't covered disaster yet. Okay, we've covered a lot of this, health promotion teaching. Haven't covered all of it, but we have covered these meds, you know, some of these childhood ailments. Okay. We've covered some of home health, hospice and palliative care, respite care. So I want you to go through and we've covered this here. We've covered your vulnerable populations at the end, your migrant farm workers, your rural, homeless, poverty. Okay. So I've already covered quite a bit of it. So I'm encouraging you to take the time in the next week or so and go through and fill out what we've covered. It's just less you're going to have to do at the end. Does that make sense?
I thought we was gonna fill in some of these boxes together or something like that.
We could, if you wanted to. I want to get to the study guide, but we could. Let's go down to the vulnerable population. Okay, let's think about our directions up here. Okay, think about ADPI. Think about your nursing process, your ADPI, when addressing completing each topic, right? Requires some critical thinking skills, how to apply the nursing process from assessment to evaluation. Okay. So let's go do our section on vulnerable populations at the end. Okay, so let's migrant workers. Let's think about our ADPI for migrant workers. We kind of went through this a little while ago. How does your nursing process look? Right? What do we think about when we think of migrant workers? I think of exposure to pesticides. Right? So how do we assess them? I mean, this doesn't have to be a book in each of the boxes. You know, for example, maybe in migrant workers box, you say vulnerable populations. Migrant workers are at risk for pesticide exposure. Assess for, how do we assess? How do we screen for pesticide exposure? What kind of program do we implement? You know, do we do primary prevention and help them understand how to reduce their risk of pesticide exposure? So it's just, I mean, everybody's going to have different things in the boxes, but it's just, what did you learn about, what are the 2-3 important things you learned about migrant farm workers? Does that make sense? It doesn't have to be a book. Just a couple of sentences in each box. And if we fill them out now, you don't have to go back and remember all this in 6 weeks. Rural populations. What do we learn about rural populations? Let's see. We know they don't seek preventative care, right? I don't know. Can somebody mute themselves?
Of course I would.
I need somebody to mute themselves. And a bunch of you guys are not on camera. Could you guys turn your cameras on, please? Please. So what do we know about rural populations? What's important for the nursing process in rural populations? Right? I'm going to say that they need a lot of education. They need a lot of education for prevention, right? They don't seek out preventative care. How can we motivate them to be on top of their primary care, their preventative care? Right? That's what, anybody else want to throw in anything there with migrant or rural population? We know that rural populations have a huge increase in chronic illnesses. Right? Maybe up in your migrant farm workers, you could put that they don't have health insurance. They're not eligible for programs. What are some nursing guidelines, ADPI, nursing process for homelessness, cold exposure risks? Well, how do you do your ADPI with somebody, a homeless client that shows up in the ER and his head has frostbite? What are the risks? What are the cold exposure risks? What are they? You guys should know this from Med-Surg.
Would it be like
Hypothermia,
like burns, like frostbite?
Frostbite, hypothermia. And what do you do with them? I mean, what's the, you know, some of these are Med-Surg, and so you can go through, what would we do? What would the interventions be? What would the nursing guidelines be for frostbite? So again, there's no absolute right answer. Does that make sense? This is just getting you to summarize what you learned about each of these populations. And in some cases, it gives you cold exposure risk. And remember, this is all HESI based. And so I went through the HESI from last term, and I pulled out all the topics that were covered. Okay, I don't know the questions that were asked, but there was the topics that were covered. There was a question about homelessness, and it asked specifically about cold exposure risks. That's why that's in there. Make sense? Mm-hmm. So again, there's no exact answer. This is you guys thinking through, how would I apply the nursing process to care for rural, care for homeless, care for poverty, care for teen pregnant? Okay. Do you want to keep going, or you want to jump over to the study guide?
Study guide.
Study guide.
Yeah.
Let's go to the study guide. Okay, so do you guys have a understanding of how to complete this? Don't make this a huge, I know it's worth 5% of your grade, but don't make it a huge burden on yourselves. Okay, just a couple of sentences. What's important about the rural population? What do you remember about the content that we covered? How do we use the nursing process? Okay. Okay, study guide. Everybody's got the study guide, right? Okay, I summarized the weekly readings for you. Okay, I took this first page right from the module, right from the syllabus, in case you want to refer back to it. So this isn't anything additional. Okay. Okay. Same kind of exam, 50 questions, multiple choice, select all that apply, some math problems. The study guide is comprised of I actually looking at the exam, lecture notes, the notes that we send you every week, and what else? Lecture, exam notes, lecture notes. Okay, your discussion questions, your discussion questions, your one this past week helped you with the common childhood ailments, right? Your one the first week helped you with vulnerable populations, right? If you missed any of the live lectures, you got to listen to those. Okay, because the study guide is a summary of the lectures and the notes. So if you missed a live class, you got to get in there and listen to those. And before I forget, there was a big group that came on late. I know you guys are in the waiting room. Sorry, I didn't see you guys. If everybody could put their name and their campus in the chat, I really need that in there. Okay, that's how I take attendance. So if you haven't done that. Okay. There's going to be one more review session, and that's Sunday with Dr. Kershaw. Dr. Ford and I have already done our review sessions. I will post the recordings later today. Okay, but there's one more live review with Dr. Kershaw on Sunday. Okay, so what do we need to know? Okay, I'm not going to go through this line by line, but I'm going to show you how it's organized. It's organized into the main topics that we've discussed over the last couple of weeks. You do need to understand the difference between community-oriented nursing and community-based nursing. Okay, and the way I remember it is community-oriented is the big picture. Okay, you're focused on health promotion of, let's say, the entire community versus individuals. So if I'm functioning in community-oriented nursing, I want to look at the community as a whole. Okay, so I'm focused on health promotion, reducing health risks in the community as a whole. So I'm like the public health nurse. Public health nurse and community health nurse are often used interchangeably. Okay, and then if I'm going to be performing in a community-based role, that's much more specific. I am based in the community. That's how I look at it. Based in the community, I'm taking care of ill clients. So that might be not so much ill client, but ill clients. I might be a school nurse taking care of kids in the schools. I might be a home health nurse doing home health visits. I might be a hospice nurse taking care of end-of-life patients. So you are already based in the community, working in the community, where illness care is the focus instead of health promotion and health maintenance. Okay. Here's how I remember primary, secondary, tertiary in this box here. I do P for P, S for S, T for T. So primary is prevention, secondary is screening, tertiary is treatment. Remember, don't get tripped up with education just being at the primary level. Okay, education is at all three levels, right? At the primary level, you're educating to prevention, how to prevent. Secondary level, let's say you've early identified a group of high school kids who's at risk for obesity. Well, you've early identified them, so now you're going to help teach them the long-term risks of obesity if they keep going. And then tertiary level, let's say we have the same group of kids in high school and they actually are obese, so they have the condition. Well, you're going to educate them how to reduce their risk or how to lose weight. Does that make sense? So don't get tripped up with education just being at the primary level. Education is at all 3 levels. Okay, and then it goes through a section of vulnerable populations. If you have a good understanding of the study guide, not memorization, but an understanding of it, you're going to do fine on the exam. Okay. If you need any help beyond the study guide, go back. This is going back to each week. So today we cover vulnerable populations. So if you have any trouble understanding any of this, go back to week 3 content. Okay, you need to, here's who our vulnerable populations are: poor, homeless, pregnant teens, veteran. Don't forget veterans are a chronic or a vulnerable population. Okay, severely mentally ill, substance abusers. Okay, what are social determinants of health? That's a fancy word by saying what determines socially the health of an individual. Remember, in the community, we look at our clients could be an individual, a family, a whole community, right? So what determines the status of our health? Well, here's a whole bunch of examples. Safe housing. Do people have adequate housing, adequate transportation? Is there racism in your neighborhoods? Is there discrimination? Is there violence? Is there high unemployment? Is there access to nutritional foods for families who live in poverty? All those kinds of things determine the health of you, your family, the community, right? I've already talked about this. Poverty is a primary cause of vulnerability. Poverty affects everything. Okay, it affects access to healthcare, it affects housing, it affects food, it affects education, it affects everything. Okay, education we know plays a role, right? The higher levels of education produce better choices. Okay. What are some outcomes? We went through this. Outcomes of vulnerability. Again, this is a lot of this is a summary of what we covered. Right? Vulnerability. If you have a high risk of vulnerability, you're probably going to have a high increased risk of morbidity and mortality. Right? High risk of chronic diseases, communicable diseases. One of the most important things when working with vulnerable populations, I'm right here, is therapeutic communication. You have to be able to understand your own beliefs and values to be able to work with vulnerable populations. For example, right? Everybody is worthy of our respect, our kindness, our compassion, our empathy, right? We shouldn't be making assumptions. We shouldn't be making judgments. The most important thing is we have to let them tell us their story. Okay. We don't want to say, why are you homeless? Or are you homeless because no assumptions, no judgment. Let them tell their story. Emma's shaking her head. Are you in agreement?
Yes.
Yeah. And then we have to understand, how do we help develop resiliency with vulnerable populations? Everybody know what resiliency is. It's the strength to go, keep going, keep going, keep going, right? Resiliency plays a very important role with vulnerable populations. Okay, if they are not resilient, they feel more out of control, they're worse, their decision process becomes, right? They tend to want to be victims, right? The lack of resiliency generally leads to them making decisions that will worsen their circumstances, right? But on the other hand, if you can help them increase resilience, that is going to go a long way to helping them minimize their risk, or not eliminate their risk, but minimize it. So resiliency, that's an important word. You're going to see that word on the exam. Okay, so you need to understand what role resiliency plays. The more resilient you are, the better off you're going to be. The less resilient you are, it's just going to be a snowball effect towards the negative, right? Here, don't forget about the caregivers. Okay, caring for the caregivers of the chronically ill. Who looks at them? Who looks after them? Who takes care of them? Who checks in on them to make sure they're okay? They're at huge risks. They have huge risks for developing depression, mental illness, burnout, stress. Think of your hospice workers, right? Think of family members who care for chronically ill. Do we check in with them? Do we make sure, what do they need? Can we teach them effective coping strategies on the front end to try and prevent this? Right? But we have to be mindful of the caregivers for vulnerable populations. And then we went homeless. The most important thing to do working with the homeless is to create that trusting environment. Okay, and here's a whole section about that. Okay, if they don't trust you, they're not going to open up. If they don't trust you, they're not going to take you up on your resources of scheduling well child visits for their kids. All right, or dialysis for their kidney disease. Trust has to be developed first, because many of these people are very leery of the system and the help that's provided to them. Okay, we went through this. Homelessness is correlated with poor health outcomes. I want you to read through that. It goes through what the health outcomes are. We've already summarized a lot of this. And here's again, this little green box. Here's resilience. Vulnerability can be reversed by obtaining resources to increase resilience. Okay, one of the biggest ways to encourage resilience is making sure they understand the language of the country they're residing in. Right? If you don't understand the language, it's kind of hard to get motivated to figure it all out, isn't it? All right, so learning the basic language of the country of residence will give immigrants, migrants, rural, the ability to communicate and navigate through the systems. Right, and as they can communicate and navigate through the systems, the barriers start to fall off. Okay. And then I want you to read through the school nurses. Okay. One of the biggest things, yes, school nurses, they take care of kids with asthma, they give medication, they splint, whatever. But one of the things that a school nurse needs to be aware of is that student that's coming in with chronic headaches, chronic stomach aches, and you're finally figuring out after a couple of weeks, it's not stomach aches, it's not headaches. School nurses need to take that next step, right? Is this some kind of harassment, some kind of bullying, some kind of violence being perpetrated? So this second bullet and this third bullet address that. Okay, and the main message is school nurses need to be able to step out of their clinic to see if there are other things going on. Because as we know, bullying, harassing, suicide rates, you know, they're all increasing. Okay, the next bullet is about obesity. Okay, read through that. Unemployment and depression in the family. This goes, remember, we're still in the school nurse section. So, and I saw this all the time as a school nurse. Well, definitely the effects of obesity, but unemployment and depression at home. Okay, parents with marital conflict, right? It spills over to the kids. Okay, it spills over to the kids in school, adjustment problems. Maybe social social detriments in school, academic, they're not meeting academic standards. So a parent's mental health issues, depression, definitely is correlated with the kid's emotional insecurities in school. It's a given. I've watched this for 20 years, right? So research has shown that children whose parents have been diagnosed with depression are more likely than children's parents who have not been diagnosed with depression to experience issues at school, interpersonal issues, social issues. Okay. So, you know, if you go into school nursing, you will learn all this, but it goes hand in hand. All right. And same here, again, establishing trust. The school nurses' initial interactions with families should support the goal of establishing a good rapport and culturally sensitive rapport. Okay. I dealt with many, many cultures in my many years of school nursing. You have to take a step back and understand culture first before you can help them. Okay. In the school nursing setting, cultures look at vaccines very differently. They look at food choices very differently. They look at special education very differently. Okay. So really important for school nurses to be culturally sensitive, culturally competent. Okay. And then this last bullet is about adolescent dating. A couple of important things to remember about adolescent dating. Okay. We know that domestic violence can begin in early teenage relationships. Okay. As a school nurse, we need to be aware that any relationship that seems good now can turn violent at any time with these kids. Okay. So what do we need to ask them? We don't have to ask them. If we were going to ask them a priority question, okay, knowing that violence is pretty increased at the beginning dating ages. Okay, we could ask them, oh, how do your parents like your boyfriend? Do your friends like your boyfriend? Do you guys go to the movies together? That's all great, that's fine. But the most important thing you need to ask them at the beginning is to describe their relationship. Right? Describe it, let them talk. Do they talk about their partner cheating? Do they talk about jealousy? Do they talk about controlling? I mean, if you're talking to a 12, 13, 14-year-old girl that's already talking about these things, is that a red flag?
Big red flag.
Yeah, of course it is. All right, so you need to be mindful. And again, this is the last section of school nursing, but kids are coming into the clinic talking about all different kinds of things. So if they say, oh, I started dating and, oh, okay, well, how's it going? What's the relationship like? Just let them start talking. You'll be able to pull out words that are, or phrases that are concerning, right? So, and then the next section is educating parents about maintaining their infant child's health and safety. Okay, we've talked about this. The greatest impact on the child's overall health is the financial stability of the family. I cannot stress that enough. Cannot stress it enough, right? Kids who come from lower income families have a much more increased risk of disease and injury. Okay. And then I want you to review this, educating new parents about safety guidelines for infants. Okay. And they're all listed right here. And here's a couple of statistics about regular checkups. And remember, we're covering 3 weeks of material here, right? So know some of the statistics here. Regular checkups are recommended every 2 years. Immunization boosters are recommended every 4 to 6 years. And again, at 11 and 12. We want children to be physically active for 30 to 60 minutes. And then what do you do with parents? If you're talking vaccines, what do you do with parents that are COVID-19 vaccine hesitant? Here's an idea. Maybe provide them data on the mortality rate of vaccinated versus unvaccinated. Then how do we care for the immunocompromised child? What are some recommendations? What's some teaching that we do with parents in the house about how to limit the spread of infection? Here's some ideas. Before eating, when do you hand wash? Before eating, before, during, after handling, preparing food? So here's some ideas for minimizing infection if you have an immunocompromised child in the house. And then this last section is about gun safety. Okay, when you're doing a home visit, believe it or not, one of the first things you need to do is ask about firearms. Right? We know that gun violence, accidental shootings in the house, for access to guns, all that. Right? So here's when evaluating a client's home for safety as a firearm, here's the most important thing. First off the bat, you have to find out where the firearm is stored, right? Don't you want to make sure it's locked and secured? It's one of the first questions you ask. Does your house have any firearms? If it does, okay, yep, show me, where is it stored? Want to make sure they're locked. I mean, what if something goes wrong? Things we don't think about every day, right? And then I'm going to ask you to go through the common childhood ailments. I know your notes, week 3 notes gave you longer versions of asthma. It was double that, eczema, double that. I have broken down everything and minimized what I really need you to know about each one. So with this section, stick with this study guide versus your week 3 notes. Does that make sense?
Mm-hmm.
It's an abbreviate. This is an abbreviate. I pulled out what's most important about each one, because you will get asked about every one of these ailments on the exam. So in one way or the other, there's a question about every one of these common childhood ailments. But having Med-Surg 1, having Med-Surg 2, this should be easy for you. Okay, so I'm going to ask you to go through that on your own. Okay, and then you can review these 2 sections. We just went through them in detail today. This rural population, migrant farm workers, this is a summary of what we went through today. Okay, there should be nothing in these 2 sections that we didn't talk about today. Because remember, your study guide's a summary. Okay. So that's my quickie review. The reason why I want to spend half an hour doing this is because we don't necessarily have a good attendance at the reviews, and I understand. I heard a lot from students last term. It's just hard to get to one between school and working and family. And so as long as I present my content, which I did, I'm perfectly okay taking some time to review the study guide. Okay, so if you guys have a good understanding of the study guide, because it's a good summary of the lectures and the notes, right, you'll be fine. Okay, I promise. All right, feedback, questions. Has this been helpful? I know it's been busy. We covered a lot, but we did cover a lot today. We got a lot done. Right? You don't have to worry about your quiz. I have to sort out the quiz, but you've already submitted it. You don't have to worry about your attestation. The only thing you have left to do is your NCLEX, right? So I don't know, it's 2:45 now. We're done. So if you want to go finish your NCLEX, go finish it. At some point over the next week, you need to download your exam. I'll open it tonight and send you an email. And then I'll cover week 4 material next week. I'll cover that in week 5. We'll do week 4 and 5 together. So next week is your exam. Okay, I'd like some feedback, and you guys really need to keep your cameras on, please, please, please. Feedback. Was this helpful? doing everything?
Well, for me, I'll say yes, especially if you were going through and fully describing how you wanted us to do the HESI prep assignment.
Yeah.
Make more sense now.
Oh, yes, thank you, Celeste. I am going to take 5 minutes. I have good exam test taking strategies. Number one, do not change your answer. Unless you can convince yourself that you have the complete wrong answer and it was a boneheaded choice at the beginning, then go ahead and change it. But if it's, oh, I think I read that somewhere, no. Do not change your answer. When you read the question, try and look away. Put a sticky on your thing, whatever. Look away and try and come up with the answer in your head of what it should be before you go look at the answers and see if something is there that you thought the answer was. Okay. Do not obsess about questions. Read the question twice. If you have no clue, give an educated guess and move on. It's only one question. Do not read a question 10 times. You're going to get frustrated. Your confidence level's going to be an issue. You're going to get anxious. Don't. Give it 2 good shots. Okay? And then pick an answer. Please read the question carefully. There's lots of words in these questions that are priority. What a priority, what would you be looking for? What's a priority question? What's the first? What's the last? What's the greatest? What's the least? What's a priority phrase? What would the nurse do first? What would the nurse do last? You have to be able to pull out those phrases. When I do my exam reviews, this is the biggest area I find that students just didn't read the question thoroughly. Use your board, use your whiteboard, your paper, whatever you have to write down any important words or phrases that come out of the question. Write it down. Okay. Remember to be able to recognize a negative question. Okay. So the negative question is, you're teaching a mother about the importance of having a smoke-free environment in their home. What does the mother say that you know she requires more education? So we're looking for something negative for her to say, right? Like, oh, I vape, or I do e-cigarettes. Would that be concerning? You guys are all looking at me funny. Do you understand what I mean by a negative question? You're looking for the wrong answer, right? Does that make sense? So let me give you another example. You're mentoring a new nurse and you're standing in the room as she's doing discharge teaching with a patient with diabetes. Which statement did the nurse make that you know she's going to require more attention? Let's say she talked about fruits and veggies. Nope, that's fine. She talked about low sugar diet. Nope, that's fine. She talked about always using 100% fruit juice.
That's wrong.
That's the wrong answer. It's the wrong answer, but it's the right answer. What does she say that was wrong that made it the right answer? So please be mindful of negatively asked questions. There are negatively asked questions on this exam. All right. Take your time. You have plenty of time. Okay. You got 75 minutes. Okay. There's nothing that drives me more batty than students being done in 30, 35 minutes. No need for it. And again, if you've come to class, if you're taking notes, if you're reading the notes we send you, if you're really looking at the study guide, you're going to be fine. Okay. Don't worry about it. Okay. What else do I have? Does anybody have any test taking strategies that they use eliminating answers? Here's another one. There's usually one answer that doesn't have anything to do with the question, right? You can eliminate that right off the bat. And then you're reduced to 2 or 3 choices. So try and reduce an answer, or try and reduce the number of answers you're choosing from. The other thing too is if you're reading a question, it seems long or lengthy, read the question, maybe try and take out all the fluff in the question and reword it in your own mind. What are they really asking? That's always a good strategy. I'm just from experience. This is what I do in my reviews with the students. How can you reword the question that makes it easier for you to understand? Like that whole first part, yeah, they gave me all that information, but it really didn't matter of what the question was asked. So reword it in your head. What are they really asking? Okay. Does anybody have any other strategies they use that would be helpful to everybody else? I'm excited for you guys to take this exam to see how well you're going to do. I am. You guys will be fine. Anybody have anything to add before we end? And then here's the last thing I'll say. After you've gone through all your studying next week, you've listened to the recordings, you've listened to the review recordings, lecture if you need to, you've gone through the study guide, you've picked apart the study guide and went back to the resources you have if you don't understand something. So if you need more information on the vulnerable populations, you don't understand what's on the study guide, go back to your education sheet that we went through today. So I need for you to do your due diligence, okay? Once you do your due diligence in preparing, if there's still things that you don't understand, reach out to me next week and I'll Zoom with you and we'll go through it. Okay, but I'm not going to go set up a tutoring and go through the whole study guide. That's not worth either of our time. I need you to do your part in studying and preparing. And then whatever you're stuck with at the end, I'll help you with. Is that fair?
Yes.
Okay. Well, I hope all you guys have a nice weekend. You made it through week 3. Yay! Made it through week 3. And then next week we'll take the exam and we'll keep moving forward. All right.
Mm-hmm.
So, you may want to take a couple of days and just focus on your med surg and your peds. You're pretty much done with community for right now, right? Get your NCLEX turned in and get your NCLEX turned in now. And then you don't have to think about community till the middle of the week next week when you start studying, right?
All right.
So this is a good time to catch up on med surg and peds. Okay, just my suggestion. All right, it was really good to see everybody today. I hope you have a nice weekend. Reach out if you
You
need
too.
anything. Okay.
Thank you.
All right. Bye.
Thank you.
You're
Bye-bye.
welcome.
Thank you. Have a
You're
good
welcome.
weekend.
You're welcome.